Hi, students. Today we're going to talk about the historical recognition and some key aspects of the right to health. The material that I will be covering with you in this video lecture comes from a statement that was jointly written by the Office of the High Commissioner for Human Rights in the United Nations and the World Health Organization. It was included in your glossary textbook, which I know sadly many of you left behind in your dorm rooms. So your teaching fellows and I linked to a longer copy of this article on Blackboard. But for the purposes of what we're covering in this class, we're really focusing in on those key aspects of the right to health, which I will be addressing more over the course of this lecture. So initially, the official recognition of the right to health started with the 1946 Constitution of the World Health Organization. It's a recognition that the right to health is a fundamental part of our human rights and of our understanding of a life lived in dignity. And it's formally framed a little bit longer than just the word the right to health when it's talked about in different international organizations as the right to the enjoyment of the highest attainable standard of physical and mental health. That phrasing is really intentional because not all people can be equivalently healthy with each other. We have different social determinants, we have different genetic predispositions, we have different environmental conditions in many cases. And so the right to health does not say that everybody has a right to be as healthy as everyone else, but that we all as human beings have this right to the enjoyment of the highest attainable standard of physical and mental health that we can have. In, again, this 1946 Constitution that really founded and framed the World Health Organization, health was defined, as we've talked about in several occasions in this class, as a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. The preamble further goes on to state that the enjoyment of the highest attainable standard, there's those words again, of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic, or social position. And so it is really a right for all. It was further codified in a few more important documents and treaties. In 2 years after the founding of the WHO, the Universal Declaration of Human Rights also mentioned health as being an adequate standard of living that people had a right to. 1966 had the International Covenant on Economic, Social, and Cultural Rights, which again recognized the right to health as a human right. This was further recognized in multiple subsequent international treaties involving countries from around the world. And it was reaffirmed with the Declaration of Alma-Ata that really focused on that right to primary health care that we started off our semester with addressing, and that's really kind of carrying through a lot of these concepts. I'm giving you these dates and these names not because I want you to memorize them, but because I want to emphasize that there is weight behind this. There is a history behind this. This isn't just some new idea. It's not a fringe belief that maybe some people have. It's a broadly recognized universal right that people have, this right to health being the highest attainable standard of health that they can have, both physically and mentally. There are a couple of key aspects of the right to health that I want to address with you. So the first is that we can define the right to health as an inclusive right, meaning that it's going to include a wide range of different factors that can help us to lead a healthy life. Some of these will seem familiar to you because they were brought back into the Declaration of Alma-Ata. So things like safe drinking water and adequate sanitation, safe food, adequate nutrition and housing, healthy working and environmental conditions, and health-related education information, as well as gender equality, are all part of these key aspects of the right to health. It also contains freedoms. And the way that the UNHCHR and the WHO have really framed this addresses these as freedoms from. We'll get to freedoms too in a moment. So it contains freedoms from non-consensual medical treatment, such as forced sterilization and unconsented experimentation, and from torture and other cruel, inhuman, or degrading treatment or punishment. And so the right to health contains freedoms from these types of exploitation and abuse. It also contains entitlements. We can think about these as freedoms too. And the word entitlement has gotten really a bad rap in our political discourse. Entitlements aren't a bad thing. They are simply what people are entitled to as members of society as the result of their humanity. So the right to health contains entitlements, including the right to a system of health protection, providing equality of opportunity for everyone to enjoy, again, that highest attainable level of health that they can have. It includes the right to prevention, treatment, and control of diseases, to access essential medicines, to maternal, child, and reproductive health, for equal and timely access to basic health services. It includes the provision of health-related education and information. And it also, really critically here, includes the participation of the population in health-related decision-making at the national and community levels. This is really a recognition that we can't simply have a system that's built on elites deciding for the masses, that there has to be some input and engagement of the people in this process as well. The right to health also is very strong on non-discrimination, and emphasizes that health services, goods, and facilities must be provided to all without any discrimination in their provision. And these services, goods, and facilities must be available, accessible, and of good quality. To break that down a bit. They must be available in sufficient quantity to meet the needs of the people rather than constrained in number. They must be physically in safe reach for all sections of the population and not only for example, able-bodied adults, including children, adolescents, older persons, persons with disabilities, and people from different vulnerable groups, including incarcerated persons. They must be financially accessible, that is, not unaffordable. And they must respect medical ethics and be gender sensitive and culturally appropriate in their provision. They likewise must be scientifically sound and of good quality, which really underscores our understanding that public health is an evidence-based discipline and that this right to health does include provision of health that's based on a scientific foundation.